Why is this an important decision for the FDA on children under 5?
Well, obviously, it's important to get as many Americans vaccinated as possible. Now, when you look at the younger age cohort, and let's face it, these kids are all little virus incubators, as anybody who has kids knows. So it's important to remember that it's not just about protecting the kids themselves from the virus, but all of those around them: siblings, parents, caregivers, camp counselors, teachers. So it's a step in the right direction to continue full vaccination of the American population.
So as I looked at the reports, at least in the press, it looks like these vaccines are significantly less effective in dealing with the small children than they are in adults. I mean, when we were originally approving the Pfizer vaccine, it was something like 90% effectiveness. We're talking about something like 37 to 50%, depending on the age of the child under 5.
That's right. Yeah, but the thing to remember is they are safe and effective, and the risk benefit against getting COVID is still rather significant. And again, a vaccine doesn't make you immune to the virus, not even as for adults, but it does show you that if you do get infected, your manifestations will be much less severe. You won't be hospitalized, and you're less infectious, which again is a crucial aspect of making sure more people get vaccinated, including children.
We had vaccine hesitancy for adults, even some of the elderly. And I think we've seen it even more so with children, because I think if you go to the 5 to 11-year-old segment, it's something like 30% are vaccinated right now. What can or should the government do, or the rest of us for that matter, to persuade parents of the cost benefit analysis you just went through?
Well, it's a slow uptake, but we can't get COVID fatigue here. We've got to keep on it, and not just for kids, but for the unvaccinated American adults who still are holding out. And again, it becomes a question of education and persuasion, and we've got to stick with it. The president has said he has a strategy in place to vaccinate young kids. I don't know what it is. He hasn't really shared it, but we've got to stick to it. If we want to continue the movement from pandemic to endemic, which I think we're doing rather successfully, it's going to rest rather heavily on increased vaccinations, initial vaccinations, and also booster shots in the years to come.
Well, exactly. Booster shots. I was going to ask about that if I could. I'm sure you'll say it's not a zero-sum game, but should we be spending more of our time and effort on getting the initial vaccinations done, whether it's adults or children, and a little less time on the boosters?
I think that's right. And we've got to keep our eye on the prize. And if people aren't getting their initial doses to get vaccinated, booster shots are not even relevant. And that's true for every age group. And there really isn't a strategy in place for that. In fact, I'm hearing a lot of people say, well, the people who haven't been vaccinated, they're irredeemable. We should just forget about them. And I don't agree with that at all. I think that there's a lot of work yet to be done. We've got to succeed. But we're not going to succeed unless we have a strategy and proper tactics in place.
You make the very important point that nobody said that getting a vaccine keeps you from getting the virus. It should help keep you out of hospital or worse. There are reports just today in Europe about increased hospitalization rates, not just getting the virus, but hospitalization rates because of something called the BA.5 variant, I guess, of Omicron. How concerned should we be about that?
Well, it's an interesting statistic, but you have to look into what that means. And the people that are getting hospitalized are largely those who aren't vaccinated. So it goes back down to our previous statement about you got to get people vaccinated. That means infection rates go down. It means infectious Americans stop infecting other Americans. And that's where we've got to go. It all goes back to a primary foundational strategy of getting Americans vaccinated.
There's going to be a meeting at the end of the month, as I understand, at the FDA to talk about the future of vaccine strategy for vaccines, for boosters, and by the way, for having customized, as I understand it, versions of the vaccines for different variants. What do you expect to come out of that?
Well, it's hard to say because the people around the table aren't really focused on a grand national strategy, which is really what we need. Because at the end of the day, if you don't realize that people take in information in different ways, you're not going to be successful. I'll give you an example. Tony Fauci, who's done yeoman's work, throughout the pandemic, simply isn't liked by a large majority of unvaccinated Americans. So having him speak to that cohort doesn't make sense. So, what's our strategy for people that don't trust the government? Who do they trust? Doctors, influencers. How can we reach out to those people to make them part of the process?
And finally, it's always hard to look around the corner, but help us try a bit here. What do you think the next big challenge in fighting this pandemic is likely to be?
I think the next big challenge is explaining to people that every year we're going to need a COVID-19 shot, just like we get a flu shot every year, that viruses mutate, and that, like with the flu shot, you have a new variant, you have a vaccine that is specifically tailored to that variant, and it's going to be exactly the same thing for COVID-19. And the good news is we'll likely have vaccines that provide protection against both the flu and COVID-19 come next year.